Alright guys, I'm back. So part 2 of the video for the surgery recovery. I'm just going to give you guys tips on how to recover while dealing with autoimmune disease. A lot of people have asked what kind of surgery. So what I had is a female surgery. It's listed as an incision of a vulvar abscess. But the vulvar region can be a whole lot with the female anatomy. But mine happened to be kind of like at the mons pubis. Which I'll put that word across, happened. As you know, you can get lupus lesions, vaginally in your nose, mouth. I had one, and I think what happened is shaving, it became infected. So at first they just was like, okay, here's antibiotics, but it just wasn't, it would happen every month, and I would notice that it would drain and be painful the week before my Benlysta was due. And like I've said in previous videos, that's when I am at my lowest, I feel, with my immune system. Sorry, I'm turning the camera. That I feel like almost death the week before. And I feel like my immune system is more susceptible at that period because I feel like the Benlysta is not there working anymore, and I only have the CellCept to cover me, and that's why they put me on the prednisone to help with the flares. So it would be like clockwork, like I was still having, like if it was a period, the thing would drain. So the doctor is like, well, let's put you on antibiotics. So the months that I would be on antibiotics, it wouldn't drain, but then my lupus would, go haywire. So this continued. I had surgery a year ago. It was in June or July of last year. And the incision at this point was about this wide. And the doctor said it wasn't a guarantee that it wouldn't come back, because my immune system is just at the point where it's shot. So I can't fight off things like everyone else. So it kept happening. So he was like, well, we can go back in. And he wanted to put a wound vac. You're not putting a wound vac down there. Sorry, not going to happen. That's just too drastic. And no. So I was kept saying, no, I don't want to go through surgery again. I'll just figure it out. So then he sent me to infectious disease. Some people have the leery, like, oh, infectious disease are only for people that have, HIV, AIDS, or, whatever. And that's not the case. Infectious disease treats people that have weakened immune systems, people that have been on antibiotics for certain things like staph infections, stuff like that. And your regular doctor can't figure out how to get it, to end. They can figure out antibiotics and a regimen to get you better. So I went to the doctor. He looked at the site and he was like, you've got to have surgery again. It's chronically infected. And he was like, it doesn't matter. He's like, I can put you on antibiotics for 6 weeks, but as soon as you stop the antibiotics, it's going to come right back. So I knew what I went through last year, and you have to keep the area, clean and dry, no sweating. So I made the mistake last time having it in June in the heat of the summer, which that's not good. The wound last time, it got infected probably a few days after surgery. So you could know I was very, very frustrated. So after talking with, this doctor, talking with my husband, we were like, fine, we have, I gotta get it done again. So this time he cut, the scar is literally from one end to the next. It's from groin to groin. And he had to go deeper to almost the pubic bone. So of course, him having to go through scar tissue and everything from the last surgery, and I've had a lot of abdominal pelvic surgeries from having endometriosis. So that's why my recovery is just so hard. So I want to give you guys some tips on how to try to manage when you're having surgery or some type of procedure where they're going to be using anesthesia. Even an in-office procedure, I can't even say anesthesia like that. How we have to do differently than the average person that's going in for surgery. So if you keep watching, I'll give you guys some tips and what I've learned over the years of all of my many surgeries. And I hope you guys, it's informative, and this will probably end the series. I'll see how long it takes for me to get the tips out, because I don't want to make it too long, but I want to make sure everyone kind of understands. So that's where I'm at. I have talked to the doctor's office today. My doctor is off. Apparently he was on call all weekend, which I should have called. They're thinking it's just a blood vessel that could have popped because the blood is seeping through the incision. The incision is not open. And they felt like my abdominal pain was because I needed to, have a BM, and I have not. Which I'll get into the tips about that later, but I'm not really sure that's all what it is. But I'm just going to watch it, and, if it persists, with the leg pain, the shortness of breath, all of that, then I will be calling them back or going to the ER. But I'm praying and hoping that I don't have to do that. So, enough chit chat. Let's get started on tips on recovering from surgery/procedures while dealing with autoimmune. All right, guys, as soon as you know that you are having surgery, the first thing that you need to do before having the surgery is schedule an appointment to see the necessary doctors. Of course, with autoimmune, you need to visit your rheumatologist. I had to visit my pain management, and some people need to visit their primary care. The reason being, your rheumatologist can get with the surgeon to let them know if you need steroids. Hey, lupus flares are worse when you have to go through surgery. Pain management can get your pain under control and tell you the regimen that you need. You need to also let your surgeon know any diagnosis that you have secondary to your autoimmune disease. With that being said, secondary diagnoses as far as antiphospholipids, clotting disorders, Raynaud's disease, Sjogren's are very, very important for your surgeon to know so they can know how to better treat you. Also know that flares will occur 90% of the time after having surgery. So be prepared to feel much worse than the average person would feel after surgery. Get with your rheumatologist to make sure that you are covered with medication to alleviate some of the flare symptoms. All right, once your surgery is complete, here are the tips you need to follow once you are home from surgery. Follow your doctor's orders. Whatever they tell you, you need to listen. Make sure you get plenty of rest, but at the same time, make sure you are moving to prevent any blood clots from happening. Other things is drink plenty of fluids because most lupus patients have to be on antibiotics after their surgery, and the more fluids you intake helps to break down the antibiotics for you. Also, after anesthesia and you'll have pain medication, please take a stool softener or at least talk to your doctor about this. You can do this or a Miralax because the constipation from the anesthesia will cause severe abdominal pains. Depending on your type of surgery, no lifting, and make sure you use your support system in your family. And also keep all post-op doctor's appointments and call your doctor, of course, if you have any problems. Thanks for watching, guys. I hope this helped give you some tips on preparing for surgery while dealing with autoimmune. Don't forget to like, comment, subscribe, and share with someone. Have a blessed day.